Welcome back. We are getting your health care enrollment questions answered with Morgan Campbell, Laura Packard, and Catherine Sevier. Let's talk about this. Someone is asking, how much income do I need to qualify for the ACA health care plans?
If you are a single person and your household consists of just you, you would actually need $12,880 to qualify.
Okay. This person is asking, why did my insurance go up for next year? Laura?
Well, it sounds like his or her insurance company mailed an auto renew letter. And so what you should do is go to healthcare.gov, make sure your income is correctly entered so that it reflects, the most current numbers, and check your policies, because whatever you're auto renewed to may not be the best, cheapest, most affordable policy. So look through your options and don't auto renew.
Mm-hmm. Catherine, this person's saying, what is the donut hole concerning prescription drugs for Medicare, and do all insurance vendors have this?
Yes, all insurance vendors have it. The donut hole is a dollar amount that once you have hit that, you pay for the drugs, and then after that, you hit a catastrophic and everything is picked up afterwards. But it's fortunately going to go away in future years, but right now there's still a donut hole there.
So it's kind of like a deductible kind of thing?
It is. It starts out that Medicare pays for the drugs, then you hit the donut hole, you pay, and then when you hit the higher level, then Medicare picks up again. It's one of the reasons that you really need to look about having a prescription drug plan so that you can manage all of that pricing and keep your costs down to a minimum.
All right, and so as you're enrolling in Medicare, that is one of your options, is to get a prescription plan. Okay.
And one way is it's called Part D, but many of the supplemental plans also have a prescription drug plan with them where you would get your Part D coverage that way.
Okay. This person says, I received Social Security, and as a retired North Carolina state employee, I received the insurance offered by the state. I've been very satisfied with these plans. Is there anything else I should do?
No, you have a retirement benefit.
So this is all good.
This is all good stuff right there.
Okay. All right. This person is saying, why would someone want a Medicare supplement plan versus a Medicare Advantage plan?
Depends. There's a number of reasons you would want to make a decision of whether you want to be in a Medicare Advantage plan versus traditional Medicare. Traditional Medicare is what most of us know of as Part A, which is your hospital coverage, Part B, which is your physician and your outpatient coverage, and then we were just talking about a prescription drug plan. A Medicare Advantage plan is a managed plan where all of that is rolled into one set of pricing, and some of the benefit of that is that it will have other things attached to it, often like eyeglasses, dental, hearing aids, those kinds of things. But you may not be in a community where your physician is in that plan, or where the deductibles work out for you. So you want to shop it based on where you live, who your physician is, and what your needs are.
Gotcha. Okay. All right. Let's talk about healthcare overall, Laura. Right now, things are going on in D.C. What can you tell us latest?
Well, things have been going on for the past few months now. Congress is working on a bill. You may have heard it called Budget Reconciliation or Build Back Better. But this bill has multiple pieces that will affect your health care potentially. First, it makes the ACA subsidies that were in the American Rescue Plan last until 2025. So if you get your health insurance through the Affordable Care Act, it will keep your rates cheaper, at least through 2025. Second, it fills the Medicaid gap. So in states like North Carolina that didn't expand Medicaid to low-income people, Morgan mentioned earlier, you had to make a certain amount of money to qualify for an ACA plan. And so if you don't make that much money, right now you probably don't qualify for anything. And if this goes through, then you would qualify for a $0 plan through the ACA exchange. Also, there's going to be a Medicare drug price negotiation and a cap on insulin at $35 a month. So if you have Medicare, it may lower your prescription costs. And even if you don't have Medicare, if you are a diabetic and you rely on insulin, it should lower your insulin costs too.
All right, so we'll see what happens with that legislation and see what comes out of that. This person is asking, is there any way to filter results for plans if you get too many to review? And we were talking about how it is kind of overwhelming.
Not really. You just have to do your due diligence and scroll through and scroll through and scroll through a little bit more.
Okay, so here's a way that you can help with that, and that is to talk to an insurance broker, because they can actually look through that and they kind of know some of the plans that you need to have. And Morgan, that is something that you do, and you make a point saying if they ask you for a fee to walk out or hang up the phone.
Correct.
Okay, and Laura, you had a tidbit about something to make sure when you go to an insurance broker to ask about.
Make sure that they're not going to charge you anything, and also that your plan is an Affordable Care Act plan, that it has all of the essential health benefits. If they're talking to you about a short-term plan, it may be cheaper, but it may not cover you when you really need it.
Okay, all right. We've got to take a quick break. We're going to be back with our last segment and your text questions next.